93.9 as we journey into the world of nutrition, fitness, mental health, and other holistic apertures in the world of health. Don't miss out on the valuable information that can transform your well-being, because a healthy life is your ticket to a wealthy life.
Ẹ káàárọ̀ nílùú Ìbàdàn. Solutions 93.9 FM.
Aboki shoemaker, they call you for years. I beg you stop that shoemaker guy.
Shoemaker, where you they come and fix my shoe. Shoemaker, where you they I need you now. I call you because I know say now you feel fix out. Nah. Shoemaker, where you they I need you now. Shoemaker, where you they come and fix my shoe. Shoemaker, where you there, I need you. I call you because I know say now you feel fix out. Nah. I know where you there, I know where to find you. Oh, the points be saying a person where go fix out. Me I go call low, cause now him sabi the thing well. I no go carry matter of shoe, go give the carpenter, nana, cause he no sabi the work at all.
Okay. Me bring them now.
Carpenter, where you dey come fix my chair? Carpenter, where you dey? I need you now. I call you because I know say now you fit fix out. Nah. I know where you dey, I know where to find you. Yes. Oh, the boy be saying a person where go fix am. Me I go call you, cause now him sabi the thing well, yo. Well. I no go carry matter of chair, go give a shoemaker, no, cause he no sabi the work at all, yo. Heart fixer, where you dey come fix my heart. Heart fixer, where you dey? I need you now.
Call you because I know say now you fit fix out.
Nah. Heart fixer, where you dey? I need you, yes. Heart fixer, where you dey? Come and fix my heart. Heart fixer, where you dey?
I fix out where you there, I need you.
Call you because I know say now you fit fix out. Know where you dey, I know where to find you. I know where you dey, I know where to find you. Know where you dey, I know where to find you. I know where you dey, I know where to find you. Know where you dey, I know where to find you. Oh, the
121 Seller with the song Shoemaker featuring Simidele and Remy right here on the Remedy Dial Solutions 93.9. 23 minutes gone past the hour of 10, and it's about time we look and talk about our health. Welcome to Solutions Clinic, where we talk about everything and anything health. Good morning to you. My name is Vic Riches. All right, as I mentioned earlier, we're going to be talking about prostate cancer this morning. Be reminded that we're streaming live on Facebook as well as YouTube at Solutions 939 FM. So do well to jump in on the platform and react to it. Like, share, and comment, especially if you do have a question in that regard. Prostate cancer is a type of cancer that develops in the prostate gland, a small walnut-shaped gland in men that produces seminal fluid. It is one of the most common types of cancer in men, but it often grows slowly and may not cause significant harm. However, some types of prostate cancer can be aggressive and spread quickly. Screening tests such as PSA, blood tests, and digital rectal exams can help detect prostate cancer early. Treatment options vary depending on the stage and aggressiveness of the cancer and may include surgery, radiation therapy, hormone, chemotherapy, or a combination of these approaches. Regular checkups and discussion with healthcare professionals are crucial for early detection and effective management. Joining me this morning for the conversation on prostate cancer is Dr. Chukwuma Okoli. Good morning to you, Doc. It's great to have you.
Thank you. Good morning.
Thank you. How's your weekend?
Very well, thanks.
Awesome. So, let's start off with, I think I've been able to give a background to this. So,
Exactly.
Let's start off with what prostate cancer presents itself in terms of symptoms.
Right.
How do I know that this is possibly prostate cancer?
Thank you very much. Now, delving into the world of prostate cancer. Now, what is the prostate? This, like you said, a walnut gland located, I call it the gate man of the bladder. Okay, it's just between the bladder and the urethra that brings urine out from the bladder, okay, to the outside world, and that's where it is located. Now, it produces, apart from being the gate between the bladder and the urethra, it also produces fluid that, together with the seminal vesicle and then the spermatozoa, forms what is called semen in a man. All right, so that's where it's located, and it's walnut shaped. If you know the size of walnut, then you will know how small the prostate gland is. So if it doesn't disturb a man, you don't even get to see or notice it all through the lifestyle of a man. Now, from the age of 40 and above, every man is at risk of developing a prostate cancer because of its activity all through the life of a man. So usually it comes in, even before a cancer comes up, people usually develop issues with enlargement of the prostate. It could be from various causes. We have what is called prostatitis, which is the swelling of the prostate gland itself, whether acute or chronic. Then we have the benign prostatic hyperplasia, or the benign prostatic hypertrophy. Now, hypertrophy could be the cells of the prostate growing bigger than before, acquiring more mitochondria, acquiring more substances within the cell. It could be hyperplasia, in which the cells multiply and give rise to newer cells. And from the process of the multiplication of the cells giving rise to newer cells, we could now develop a cancerous situation where a new type of cells that does not depend on the parent cells in order to survive, they just begin to replicate themselves. That's when you have prostate cancer. And the symptoms are usually the frequency, that means the urge to urinate much more than before. Now, it happens mostly, it's experienced mostly at night, because you expect a man to urinate between 0 and max 4 times. So, okay, 4 times
a day?
overnight.
Oh, overnight,
and then you are
okay.
now having more than 4 times of urination, and then it's not like this person actually took lots of water. If you took, like, for instance, I took 2 bottles of water before I went to bed. I was thirsty though, so I had to. And then after taking it, I woke up like an hour after. I felt thirsty again. I downed another bottle. I told myself, you succeeded in canceling your sleep for tonight because you're going to be visiting the toilet. It's expected, okay? Now, when there is nothing of such, you didn't take excess consumption and then you had to now visit, that's frequency. We have the urgency, and that is the urge to urinate becomes very pressing and discomforting. We have the nocturia, which is increased urination at night, and the urge incontinence, meaning if they don't get to the toilet on time, they may urinate on themselves. Okay, so those are the common symptoms that do occur. Now, when this happen, we could now start suspecting, well, before you even talk about the prostate cancer, you will be talking about the benign prostatic hyperplasia, like I mentioned. The cells are dividing much, and then you could diagnose with them, and then you can now carry out some investigations. When we get to that, we'll talk about it. So that's just basically the symptoms that occur. We also have others like hesitancy. Somebody gets to the point of urination and then has to sit and wait until the urine comes. And then there is the strangury. The more they strain, the lesser the urine comes. So these are symptoms that comes with prostate issues.
I've also heard that you can also be asymptomatic to it. You probably will not even experience any of it.
Quite a number of times you see people who are asymptomatic. Now, apart from this, some other habits, I just want to quickly warn us, the habit of going to bed with a full bladder. It's not advisable. And so that's why I usually plead with people so that let's eat on time. I say let us because I'm also talking to myself.
Yeah.
So let's eat on time. So when we eat on time, meaning on time, I mean max before 8 o'clock you've had your dinner. So you can drink all that you have to drink, then sit down and then wait for digestion and then pass the urine as much as you can before we go to bed. You know, going to bed with full bladder, you're not encouraging, you're not helping your prostate gland. You may contribute to things that may happen. So I think we should work on that as well.
Fair enough. You've mentioned earlier that men between the ages of 40 and above should pay attention to screening.
Yes.
So below 40, is it that you're safe from it?
Well, basically, I used to say 35 and above. Because I've seen a couple of people. I even diagnosed a patient at 38 already with prostate cancer.
Wow.
And I've seen a couple of men less than 40 and they came up with a benign prostatic hyperplasia. So I've seen things like that reoccur. And so we need to just pay attention. From 35 and above, let's pay attention. Less than 35, well, you can just have it in mind that when you get to that age range, you check yourself once in 6 months. It's important.
Fair enough. Does family history play into, coming down with prostate?
Yes, genetics, family history does as well. So if you have a family member who, like when we talked about hernia briefly one time, I talked about the fact that I have a close family member who had, and exactly on the side he had, I also developed it at some point, and I was like, wow, this thing is real. It's real genetics. So you have to pay attention to yourself and your family line. So if you have a sibling or you have a parent that has hypertension, beware. You have a parent that has diabetes, beware. Or an elder sibling that has any of these things, beware. You too may. So it's not a time to say, oh, you see that bottle of soda, I don't want to mention names, that bottle of soda, I'm going to down it. Well, me, I don't care. Whatever they let them say, I will drink my own. Well, enjoy it for the moment, but know that you are writing a letter to ailment. Please be careful.
So earlier I mentioned the reason I think most men, refuse to go for screening.
Yes.
Dr. Bernard, he put out a tweet regarding prostate cancer, educating people, spoke about how aggressive and how the severity can, destroy a man's life. And I was going over the comment section, and if the comments were 100, I noticed that 98 were asking, why should a doctor have to put his hands or fingers through the anus of a man to screen or check for prostate cancer? You find that most men weren't comfortable with that idea, and I think it's the reason we don't have, most men going for screening. Are there other ways this can be done, or that's how it's done?
Okay, it's called, what you're talking about is called digital rectal examination. Let me appeal to you. Let's not make issues with it, please. Let's not make issues with it. I tell you, because that is in a situation where you have constriction of resources. A digital rectal examination can diagnose these things for you. By the time you put in, you can check for you realize that, oh, this thing is, some people, their prostate is so large, it's almost occluding the anus, the space.
But do you know as a person that something is disturbing you?
They don't
within-
get to know. They just realize that they're having
Wow.
issues with urination. So I don't.
So
I
even when
understand.
you're trying to pull,
Yeah.
you don't feel any sort of pain.
They may, but
Okay.
of course they will just accrue it to some other factors. Now I understand the fact, but let me just, I beg to say this: even the females too, when they have issues that requires that, they go through it. So I'm pleased. Let's not really make any issue out of it. It helps the doctor to diagnose firsthand. At least, if he might not tell you it is prostate cancer, but at least he will tell you this prostate is enlarged right there and then as you came in for diagnosis. You can go for a prostate scan. They do a volume. Okay, check this. They do Doppler of it and check the increase in vascular flow and tell you, okay, the volume is greater than 40, blah blah blah. Yes, you can do other. You can circumvent that finger dipping, but then at first that will give you a hint. And it's always ideal when a doctor tells you, hey, from this initial assessment, this is my suspicion. But if you refuse, of course, the doctor should not enforce his way, because let me tell you, it's not interesting, no, truly, to dip your hand in somebody's bumble. I must tell you the truth. A lot of times I've had to wash and wash and wash, and then psychologically I'm still perceiving poo-poo in my fingers. So do you
No, but you
think
use gloves.
of
now.
course, we use double gloves, sir. And I don't know, maybe it's my psychology. I still feel like it's still smelling. Oh, God. And then for like a day or two, I won't even I mustn't even take swallow. Even if I will, it will be spoon. And I'll avoid anything that will bring my hand to my face. So that feeling itself, it's not like we enjoy doing it. So don't let's just preoccupy our mind with why our doctors. Look, it's not interesting. It's not fun. Okay, it's not. It's not fun doing it. But then, if that is what I need to do to diagnose you, if that is what I need to do to give you first-hand information as to your state of health, please. Even me, say, when they do, I'm not say they interest me. So I dey block my nose, try do, I'm like bend over and I dip in my hand. Come on, I'm even looking away doing the stuff. So if I have to, it's called digital rectal examination. We have others. We have the scans and then other things.
So,
that can be used.
like I asked, are there other ways to it aside
Yes.
the digital rectal
You
examination?
can do a prostate scan.
Okay.
Yes, you can do a prostate scan. to
But it
help.
seems like the digital is more.
Of course, first-hand, it gives
Okay.
you first-hand
Effective.
information. Yes, quite effective, and then you can even the prostate scan, even if it's enlarged. I mean, when it tells you it's enlarged, then you now need to do other things like the prostatic specific antigen (PSA). Then in the diagnostic golden index, it is the prostate biopsy. You take a little out of the tissue. That one too, you have to dip in a pin, a very long pin, guide it. Okay, it could be ultrasound guided. Get to the prostate, take a sample, and then put it in a tissue, in a container, and then take it to the laboratory and then use under an electron microscope to check if you can make your assessment of a prostate cancer. Prostate biopsy is the gold standard of diagnosis for prostate cancer.
Fair enough. Another thing that we've seen people talk about, which has become a social trend is, one of the ways that has been stated to reduce the risks of coming down with prostate cancer, which I saw was ejaculating at least 21 times in a month. Some people say via sex or even masturbation. I've seen and read quite a number of things. I think there was a video of a doctor that trended one time that he made such audacious statement on radio as well. So how true and assertive is this, that as a man, if you continuously involve yourself in sexual activities, ejaculating at least 21 times in a month, you will not come down with prostate cancer?
Well, yeah, increased sexual activity is protective for prostate. That's the truth. It's just
Okay.
that it's not so comfortable, but that's the truth.
I mean, there's a level of energy you have to want to indulge in that for
I'm telling
20.
you, I'm telling you. Like, as if you don't get what way they do.
Yeah,
Just,
I kind of.
sit in the house and be doing what? when others
Oh
are
my
hustling.
goodness. So how aggressive can prostate cancer present? How bad can it get?
It could be. It could be. In fact, I remember that as we're talking, I remember one of my patients, and as one part of being a doctor, that when history beckons you, you could be emotional if care is not taken. I watched this man, you know, he comes regularly. He had prostate cancer. By the time we even diagnosed him, by the time he came complaining of the urinary symptoms, he already had the cancer. Then there is this leg swelling, unilateral, or it could be bilateral. That is, either one leg or two legs will be swollen. And then, of course, they're not able to. Some can still pass urine with difficulty. Some will not even be able to pass at all. That you have to bypass putting the catheter through the urethra. You don't have to go above into the bladder to introduce the catheter. That can be very, very, discomforting. In fact, such a person will not want to urinate where people are because he can't touch his penis. You'll have to, use a rubber and then pour the thing out and then cover. And he has to live like that. And then, he went for chemotherapy, and then I actually, was with him in his last moments. And prostate cancer is a killer. It's a killer. So my suggestion or my appeal to Nigerians is, if you're 40 and above, please do your PSA every 6 months. Every 6 months, just do your PSA. And if you have above 4, then you might need to go for just
above
a review.
4 what?
Yes, 4 nanogram per mil. I mean, that's the value.
Okay.
0 to 4 safe, above 4 suspicious, 4 to 10 suspicious, more than 10 that's red flag. So we need to check. Once your PSA is above 4 nanogram per mil, you need to do something about it. It's that important.
Well, you're listening to Solutions Clinic this morning, and I'm having a conversation with Dr. Chukwuma Okoli. We're talking about prostate cancer. If you have a question in that regard, you can text me on 0904 422 2939. 0904 422 2939. What are the risk factors associated with prostate cancer, or what even causes it, other than the hereditary factor that we mentioned earlier?
Basically, that's just it. Every other factor, like environmental factor, sexual factor, all those things, we can't really pick and say, oh, this is it. It's basically genetic. It's not like sexually transmitted infection that you say, okay, when you have multiple sexual partners. No, it doesn't really, it's not really indicated. It's basically genetics. So we could, all those things we call risk factors, okay, they may not point you in the direction of prostate cancer. It's just like breast cancer, so the gene, once the gene is isolated in the body, okay, so such a person is at risk of it.
So other than chemo, what are the treatment options available for prostate cancer?
If it's diagnosed, now depending on the time of diagnosis, if it's diagnosed early, the prostate can be removed, and then you now do tumor markers, and then if you find them, you can give some sessions of chemotherapy after removal of the prostate. But in this part of the world, diagnosis is always late, and by the time they eventually diagnose such a person, well, what we do is called bilateral orchidectomy. That is, the testicles are removed because the testicles supply the prostate with hormones that makes it to grow. So you remove the testicles, that's like castrating the person, and then you can now give your sessions of chemo or brachytherapy or radiotherapy. Radiotherapy is you put in your radiation waves to it. You can now do it directly on the prostate, that is on the tissue itself. That's brachytherapy. Those things are tried, but in this part of the world, success rate is always just like 5%, so to speak.
So I guess that brings me to my next question, because I've read that even after a successful surgery, you find that people die just immediately.
That's the point. That's the point, because at times, like I said, because diagnosis is late. Now, the funniest thing is this. It's just like a negative feedback. When you are heading this way and your body feels like, hey, there's going to be trouble there, it taps you, you withdraw. So you have done a positive feedback, you have withdrawn. But imagine attempting to go, and then you tap, and then you ended up poking at the thing and causing trouble. Attempting to remove the prostate may even trigger those cells to now produce more. And especially once there is invasion and metastasis. Invasion means leaving the primary tissue and entering into another tissue. Metastasis means leaving that area where the prostate is and probably going to the lungs, going to the bone. So once there is a spread and you remove the prostate, in fact, you just told those cells, please produce more, and that's why death is almost imminent a few months after.
Very, very, very scary.
Yeah, it is. And the fact that about 50% of men are going to be involved in this kind of a play is why people need to pay attention to it.
So early detection is what will save
The day.
the day.
Yes.
So, I mean, if you have all those fears about how it's done, I think this is the time to throw it off the window because it's very important as a man, you get screened for prostate cancer. It's particularly for men. I don't think women have issues like that, do they?
Women don't. Now, their hands are full. They have their...
Indeed.
Yes, the breast is there, the uterus is there, the cervix is there, the ovary is there. So they even have more things to bother or worry about. And that's why I always tell the women around me, please make sure every 6 months visit diagnosis centers and get yourself checked. So from age 35 and above, every woman around me is compulsory.
All right. Another question I have. You mentioned it before. The benign prostate
Yes.
enlargement.
Yes, enlargement.
Is it different from prostate cancer?
Yes, it is. Yes, it is.
How so?
Okay, now I mentioned benign prostate hypertrophy. That is, each cells start growing bigger. So when each cells grow bigger, then the prostate will now grow big and now cause all those blockage I talked about: the frequency, urgency, hesitancy, strangury, nocturia, urge incontinence. It's either that hypertrophy or hyperplasia, meaning each cell now produces like 2 or 3 more. So we now have more cells and it will grow. Now, at this point, it can only give rise to what is called obstructive symptoms. That is, the urine is not flowing out well. So urine is being obstructed at various points. Okay, so that is the hypertrophy or hyperplasia. It's different from the cancerous situation where, in the case of hyperplasia, the cells are reproducing much. They can now reproduce a new type of cell that does not even require the parent organ to survive. These are new cells, and these new cells will eat up the old ones and then start producing in excessive amounts. What even makes cancer kill is that the new cells take over the system until they wreck the system. So someone can have BPH, benign prostatic hyperplasia, and not have a prostate cancer. And that time, when you remove the prostate and nothing, they are fine. They move on with their life. All they had was a BPH. Of course, you would have done a prostate biopsy, and the biopsy says it is negative for any form of cancer. You now remove the prostate. At that point, you just save the person. So the person is fine. Nothing to worry about in terms of cancer.
So essentially, removing it is the treatment for the BPH.
Yes, for BPH, yes, removal. Once it's removed. Some people would now, although there are medications people take.
Yes, because I've heard of drugs.
Yes, to shrink it. Okay, yeah, tamsulosin and co and co and co. Yes, people, not everybody will want to go through the knife to say they want to remove, like the TURP, transurethral resection of the prostate, transvesical, blah, 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 blah. Not everybody wants to. So some people will say, oh, can I use medications? But the actual truth is, if I were to, God forbid, or if I were to choose, I would rather, please remove this thing and let me have peace than to say I want to be swallowing tablet on top with it. That's the way I view things. Because I know that once it is out, it is out. It doesn't grow back. So my mind is at rest.
How does, 40 years, 45 years, we still have men who indulge in sexual activities very, actively and frequently. So how does that affect you as a person sexually?
Advantageous. It's good for them if they do. I see people who have such libidos. Please.
Is it possible to, with the discomfort that you feel, to indulge?
Well, some people have just crazy libidos. So once they have it, they should enjoy themselves. Well, it's good for them.
No, I'm just thinking about how possible it is, because with what you've explained, it sounds painful to my ears. So I don't know how you want to practice. I'm just saying, does that affect, their sexual performance in any way?
Okay, well, if they have this prostate issues, of course, it affects the libido. It affects the libido. So they tend to have reduced libido. So at this point, I'll just say, whoever is there, you're listening, and you have issues with the libido or you have issues with urinating, it's time to get up, go see your doctor. Okay, have your discussions with him, and then you guys go through the diagnostic process, and he will give you the best of what you should do.
Fair enough. Well, you're listening to Solutions Clinic right here on the Remedy Dial, Solutions 93.9 FM. We're talking about prostate cancer this morning, and I'm having that conversation with Dr. Chukwuma Okoli. Particularly if you're a man within the age range of 40 and above. He said 35 is even the number he's going to peg for screening. Then you want to take this conversation really seriously. So if you have a question, do send it to 0904 422 2939. All right, I think I just got one question here. Good morning to you, Doc, and the presenter. My name is Dio. My question is regarding hemorrhage and prostrate. Are they the same thing? And how do you help someone who is dealing with hemorrhage? I
I
don't know
think
what
you
that
meant to
is.
say hemorrhoids.
Hem-
Hemorrhoid is found in the anus. That's when the blood vessels and the anus are pushing out, and then when such person goes to poop, and then attempting to clean up, it might bleed. You see blood. If it doesn't bleed, you notice some.
That happens to
some
men?
tags. Yes, it happens to both men and women. So they notice some tags at the rectum, at the anus. So that is hemorrhoid. So that's different from prostate. The prostate is found in the direction of your wee wee. That's where prostate is. Hemorrhoid is in the poo-poo direction.
So why okay.
You know the process
I'm
to
getting
urinate and to
confused.
poop is still the same process. Okay.
Okay.
So you need pressure to do both. But hemorrhoid is in the anus, while prostate is found in the under the bladder. So they're not. The
So why
same
do you
thing.
need to put your finger at the anus to check for prostrate?
Good question. When the prostate is enlarged, you can feel it from putting your hand through the anus because it should have grown so big that it will be compressing on the wall of the anus. So you can now feel it there. And you now tell yourself, so for you to feel the prostate from the anus, it has more than doubled its size. It's walnut. We know walnut, how tiny it is. But sometimes I've been at prostate surgeries and I ask myself, some are bigger than this is a mouse, or what do we call it? And something that is as small as a walnut is now bigger than this mouse. So that will tell you how much pressure, chaos it has caused where it is located. Yes.
Okay, there's a follow-up question. If they are different, how do I deal with hemorrhoids? That's not what we're talking about today, but
Well, probably one day we'll get to talk about hemorrhoids, but you need to see your doctor. It's not really something we can. The management of hemorrhoids, well, it has to be discussed in detail. Okay, we
Okay.
have the physical, the medical management, we have the surgical management. Either way, whichever one is good for you, it can be done. Okay, so
fair enough. Well, thank you so much, Dr. Chukuma. Any final words for the conversation
Okay.
on prostate cancer this morning?
yes. So please, good sexual activity is good. It keeps you away from the line, but of course, it's also good to check yourself. If you're above 40, do your prostate-specific antigen every 6 months. If you have more than 4, pay attention and do repeated tests for it. Okay, the dipping hand into the bomb is not compulsory. There are other tests that can be done to circumvent it. So if you don't want it, there are other things. So because of that, don't go now for your screening. You can go for screening. You can do a scan. You can do whatever it is, and get checked. It's important to get checked than to manage and treat it. It's not always a successful outlook. That's even the specialists, the urologists in that regard, don't always like that aspect. They'll just push that person to the oncologist to manage it. The oncologist is already saying, oh, you already had cancer, then your life is already like 50% gone. So let me try what I have to do. If I'm successful, fine. If I'm not, to God be the glory. You can imagine. So don't put yourself at the mercy of such kind of not that they are callous with it, but the truth is reality check. So it's better you prevent such than manage it. Prostate cancer is a thing that nobody prays to experience, and for those who have it, I pray for you that the Lord will come true for you.
Amen.
Just make sure you check yourselves, and then of course inform your family members. Everybody must check themselves. Checking is more important. Staying healthy is better than treating ailment.
Absolutely. Men, it's not customary with us in this part of the world to pay, attention to our health. And this is a gentle reminder that just as women have several things they're dealing with, as a man, you have to ensure that your health becomes priority for you and you pay attention to these things, no matter how, because more often than not, something is dealing. A man feels uncomfortable, he just goes to take a malaria pill and that's it. But you don't even know, what that is. So it's important that you check yourself regularly. Go for health check. This one that concerns us, prostate cancer. please pay attention to it if you're well above 40. And we get to enjoy longevity at the end of the day, right?
Amen.
All right. That's how we draw the curtains on Solutions Clinic this morning. We'll be back next week, Monday, for another interesting subject in the world of health. My name is Vic Riches, and I've had a conversation with Dr. Chukwuma Okoli. Good morning to you.